You don't want to be guessing. You don't want to wonder, did I get it in the right spot? You want to know 100% of the time that you are 100% precise. Let's bring the future of medicine to your patients and the joy of practicing medicine back to your life. Through our PRP Now program, I provide training that's practical as it is transformative. You'll learn how to provide PRP with confidence, improve your outcomes of your patients, and boost the profitability of your practice. Here's the deal. Training in PRP doesn't have to take months or years. In fact, with the right program, you can master the techniques in just a few weeks. Did you know that traditional treatments might be holding your patients and your practice back? It's time to step into the future with platelet-rich plasma, a groundbreaking solution that's changing the game in medical practices. Your patients and your career deserve it. I'm Dr. Ariana Demers, the queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. So let's talk about PRP treatment, what it is, how to effectively learn it, and the equipment required to perform these procedures safely. Then you'll have a solid understanding of why you should incorporate PRP into your practice and why it could be a game changer for your patients. Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us. So, what is PRP? Honestly, it's been around for a while, but for an outcomes-based perspective, it is nothing short of revolutionary. Honestly, I feel like every time I use it, it's a little bit of magic, although I know there's the science behind it. It's a regenerative medicine technique that is using all of the components of the patient's own blood to supercharge healing and tissue regeneration. I always think of it as nature's way of speeding up the healing process or the recovery. Obviously, it's a process that isolates platelets, those tiny little packets of goodness that are rich in growth factors and essential for repairing injuries. With PRP, obviously, we draw blood. We concentrate those platelets far above the normal level that's found in regular blood. And that's how we unlock their full potential to reduce inflammation, promote healing, and enhance recovery. So PRP is transforming orthopedics by relieving joint pain and helping to heal sports injuries. It is magic, but it doesn't stop there. In aesthetic medicine, it's celebrated as the rejuvenation of skin and hair, and it has really been proving to be versatile across disciplines. So imagine the practice possibilities that this powerful tool will bring to your patients. So people always ask me, how do I get started? What equipment do I need to start doing PRP for my patients? And while it's not a lot, there is some critical pieces. Number one, you need a way to draw blood. So you need your blood collection kits, you need needles, syringes, and someone to draw the blood, whether it's you or you can hire that out, your nurse, your MA, someone that is reliable about drawing blood. Next, you need a centrifuge. And this is your workhorse, and you spin that down and really concentrate those platelets from the other components of the blood, giving you that really nice concentrated injectate. And then finally, ultrasound. Some people think this is an optional piece of our regenerative medicine therapies, and really it's not. In my opinion, I really am going to urge you, as this is a required piece of equipment, to do the job right. You don't want to be guessing. You don't want to wonder, did I get it in the right spot? You want to know 100% of the time that you are 100% precise. So for those tools, centrifuge, ultrasound, someone to draw blood, and the blood draw kit, then you're ready to offer these amazing treatments that don't just manage symptoms, but are actively repairing and rejuvenating tissues. People always ask me, well, how do I learn to give PRP treatments to my patients? And so I'm going to share a little experience, and that's my experience. So you got to rewind the clock a while. And so I started learning ultrasound quite some time ago, back in the early 2000s. And this was just starting. And so it was a lot of trial and error. And I got to practice on a lot of my patients. And then I started, trying it out one at a time here and there. If I figured like maybe I could get there and I've never done it, I would YouTube it. And then finally, 8 to 10 years later, I turned to the experts and I took the shortcut and had a huge, massive breakthrough in a number of, days, not weeks, months, years. And so this is where my passion for teaching and empowering my fellow physicians comes in. Training in ultrasound-guided injections and PRP does not have to take weeks, months, and years. Here's the deal. Training in PRP doesn't have to take months or years. In fact, with the right program, you can master the techniques in just a few weeks. That's why I created the PRP Now program, an orthobiologic masterclass designed for doctors who are ready to take their practice and their lives to the next level. Through our PRP Now program, I provide training that's practical as it is transformative. You'll learn how to provide PRP with confidence, improve your outcomes of your patients, and boost the profitability of your practice. It's more than a training program. It is a pathway to freedom, helping you gain control over your practice and deliver the care that truly makes a difference. Really, it does. It's amazing. And if you've ever felt trapped by the constraints of those insurance companies or the grind of those low and declining reimbursements, this is your chance to break free from all of that crud and really get your life back. Let's bring the future of medicine to your patients and the joy of practicing medicine back to your life. So we have covered what PRP is, its applications, and an intriguing new way of practicing medicine, the necessary equipment for performing these treatments, including ultrasound. And please, 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 when you're looking to buy an ultrasound, I always tell people just however much you can afford, buy that. Don't skimp on it. Don't try to save a couple of bucks, because what's going to happen is you're going to be frustrated. And the path to mastery will be longer. So as good of an ultrasound as you can afford, please buy that one. Your patients will thank you. Your frustrations will thank you. Everyone will be happy, and you will not be looking at polar bear in a snowstorm or black bear at night, wondering which way the ocean is facing. So please, please, please do yourself a favor. Open up your wallet, spend on the ultrasound. You will be happy you did. Next, what we're going to do is talk about the whole rest of the list of things. People ask me to make those recommendations all the time. So what I've done is I have created a document, and you can just click the link in the description below, and you can get access to all of the recommendations from centrifuges, ultrasounds, to other parts of regenerative practice that are really helpful. So just click the link and you can get all my recommendations. I hope that's helpful for you. And really, I want you to understand that with the right knowledge and skills, you can offer this innovative treatment to your patients. And what that does is then you have happier patients and you love your job again. So next step for you, do all the things, get all the things, and start offering this procedure ASAP.